Hi everyone, I will be discussing a cone beam computed tomography, which is also known as a CBCT. I will briefly be going over what it is, how it works, when it is commonly used, and then also the risks and benefits of it. So a CBCT x-ray is a 3D x-ray, and it is used to get all angles of a patient's mouth, specifically their teeth. And there's quite a few ways that this x-ray can be taken. The first one is by using this machine that's really common, and it's probably in all the dental offices that you've visited. But the first way is have the patient sit here, and then this part here rotates and takes pictures. The next one is very similar, however the patient stands here, and then this part spins and takes the pictures. Either way, whichever one is used to take the pictures or to take the x-ray, it functions the same way. It has a detector that spins all the way around using a cone-shaped beam, and it takes small images of every angle, and then at the end it compiles it into one large one, and you can then see all angles, and it's a 3D image. This is really cool because once the image is compiled, the large image at the end, the doctor can go in and edit it. They can rotate it around, they can cross-section specific areas and develop better treatment plans for patients. This kind of x-ray is used to basically see any specific positioning of teeth. It's really common in orthodontics. It can also be used when trying to evaluate, an implant, see what the best position for it would be. You can also use it for like reconstructive surgeries if a patient has had dental trauma. Basically anything where the doctor needs to see specific areas and see specific positioning of tissue or bones or teeth, they can use this kind of 3D imaging. Some of the risks of it is that they do give off more radiation than the typical dental x-ray, like a panoramic x-ray. It gives off more radiation. It does give off less radiation than other CT x-rays, but there have been websites and programs developed for parents to learn about how to reduce the risks of overexposure to radiation, specifically in children, since they are at higher risk for illnesses related to radiation. This has been something that has been popular since the early 2000s, the CBCT x-ray machine. It has been used commonly among dentists, other doctors as well, and it basically allows for better treatment plan. You're able to see specific details as far as the dental care. You can see roots, you can see impacted teeth, you can determine whether a patient who is having braces, who's going to have an orthodontic treatment, if they have an impacted tooth and it needs to come down, you can see where the roots of the other teeth are and make sure that it's not in the path of the tooth that needs to come down so that they're not damaged. Basically, it's been very beneficial to develop better treatment plans, and it really has allowed for better imaging and again, just better treatment plans overall.